Here is me, Nidhi Acharya of grade 10 from Jnanaranga Central School, Bellary. Today I am here with the famous cardiologist physician Dr. Shivshankar Acharya of KMC Manipal for an interview. He is working under tertiary sector. Vaidyu Narayana Hari means that a doctor should be seen in the form of Lord Narayana. Good morning, a very warm welcome, sir. I heard that you are one of the famous physicians in KMC Manipal since last 2 decades. As a doctor, what should a doctor's highest priority be while treating patients?
Hi, I'm Dr. Shivshankar, Professor of Medicine, working in KMC Manipal last 25 years. As you asked, what is the first priority of a doctor while treating the patient? It is every doctor will try to give a best kind of treatment or best possible treatment will be given to the patient to save the life.
What kind of experience have you had by working with sick people? Have this experience taught you anything that you did not know beforehand?
As Mother Teresa said, I do the dressing for wound and God will heal the wound. It is very true in our profession. We give a best care to the patient, and with the best care of treatment, sometimes we'll succeed in our treatment and the patient will recover. Sometimes even with the best care of medical treatment, and sometimes we lose the patient. So it's not in our hand. Probably 50% is in our medical treatment, and probably patient's immunity or underlying illness has a very important role, and 50% probably the blessings from the God. It is probably the most important things is comes into play when we treat the patient.
I know that you are from a small village and now you have reached this position. What is success in your opinion?
In this regard, my success in my medical career is mainly due to my hard work during my undergraduation and post-graduation and constant support my late father, and he guided me throughout my undergraduate and post-graduation. Unfortunately, I lost him in my final year of medicine post-graduation, and constant support by mother throughout my medical career.
What is your primary motivation as a medical professional?
Primary motivation in medical profession is to give a best care to the patients, irrespective whether they are rich or poor, and I wanted to see them happy at the time of discharge. They should have a good health.
Health is wealth. Could you please comment on this?
Health is wealth. It is a very famous proverb, and this is holds good for every creature in the universe. And the most important thing for every creature is when they have a good health, they can live longer, healthy, without any problems. When the people may think that when they have a wealth, they can get anything in the world. I don't think so. And when they have a good health, they can live longer, they can earn everything, and whatever the possible thing they can earn, they can live happily. So I think first priority for every people, they should have a good health. To get a good health, they should have good habits and good motivation from the family members, and when they have these things, probably they live longer.
Have you worked as a doctor in any other hospital or abroad?
Yes, I had opportunity to work abroad and even India. Abroad I worked in Malaysia, both corporate hospital and the government hospital, and even India I worked in Udupi government hospital for 2 years, and now presently I work in private hospital, that is Kasturba Medical College Manipal. I have seen a different socioeconomic group people, and I treated all different variety of people in India and abroad.
Have you felt any regret or happy moments in your medical career? If that, please share with me.
Yes, I had several sad situation in my family itself. First, most important one is I lost my father in my second years of my post-graduation. Even though I know the illness, my dad was knowing about the illness and he was on medical treatment. We could afford all the medical and surgical treatment, but unfortunately he developed acute myocardial infarction, and we lost him, and I could not do anything about his illness. Similarly, few years back, my aunt. She had a malignancy. We tried all different modality of treatment, medical treatment, and even surgery. Finally, we lost. And this is a true sad moment in my medical profession. Even though I struggled to save them, I could not do it. In this moment, the happiest feeling what I had is my father-in-law had an accident about a few years back in while coming from Mysore and had a neck injury, and I brought him to Manipal. I treated him nearly about 1 month. He was bedridden, and slowly he's improved with physiotherapy and medical treatment, and now he's walking around independently. This was the happiest situation I had, and we are given the best treatment for my medical career. And similarly, my uncle, one more person, had some hemoglobin problem. We treated him, he also became alright. These are some happiest situation I can consider is, I think, is a bonus for me. And whatever treatment, whatever given to my family member with the help of my experience, I think is a memorable one for me. At least I have done some service to my family.
How did COVID pandemic affect your career and how did you manage?
Yes, COVID-19, it has not affected my career, but it's given a challenge for us. As everybody knows, this COVID-19 infection, the mode of infection and mode of transmission, the severity, who gets the illness, nobody was knowing it. And as a medical profession, everybody we had taken a precaution, and we treated many people, and several people had a complication. We lost them, but the majority of the people have survived. And we have a lot of precautions like hand wash, social distancing, wearing precautionary gowns. With this, probably we attended the patients, and many people we are treated, and many people survived.
Was there any failure that took place when handling COVID-19 pandemic? What will you say?
Yes, the COVID-19 infection, we were not knowing which patient is going to develop severe infection, which patient is developing a mild infection. But roughly we used to tell those who are underlying diabetes or other medical problems, they wish to get a severe kind of illness, and we used to get into ICU admission, and they wish to get a prolonged hospital stay and treatment, expensive treatment they used to receive. And this is what usually the people with the multiple comorbidity they used to get into problems. Otherwise, majority of the people with the symptomatic treatment they used to improve.
What are the precautions children should take in coronavirus third wave?
Yes, the precautionary measures to avoid the COVID-19 infection is, as government authorities saying, it is very important to have a hand wash, social distancing, and face mask. These are three important measures, and definitely it prevents the transmission or acquiring a COVID-19 infection.
Sir, is there any drug mafia?
Yes, drug mafia is present in India. I think every sector in India has a mafia. But to avoid this mafia, government has made it is the life-saving drugs available in Jan Aushadhi Kendras and government hospitals for affordable price, and everybody can access this medication and get a better treatment.
Today, the public are saying doctors and hospitals are money-making machines. What is the real truth?
Yes, I don't totally agree with this statement. In India, if you see, there are different types of hospitals are available: government hospital, private hospital, and corporate hospitals. And every patient expecting a best treatment, and they expecting a good care and with a cheaper rate, a cheaper price. So it's not possible to get this kind of treatment, because in hospital the expenses of any investigations, any treatment, any antibiotics, any medications will be also huge. When they when they give this kind of treatment to the patients, definitely the cost will go up. And people may think that people are making money. I don't think so. And when they get a best care, and definitely expense level goes up. And this is vice versa, it happens. And when they get an expensive treatment, definitely expense goes up.
How do you think natural health insurances affect physicians, patients, and society?
With regarding this insurance scheme, it's very important to have an insurance scheme for all the people, because we don't know when people will get sick, and when they need a expensive treatment. That time it can be they can get these insurance schemes, they will support the financial, they'll give financial support, and they can get a better care. And this is if they start investing in the from younger age group, then probably the premium also less, and they'll get protected. Not only individual person, entire family can be protected. And regarding physicians, I don't think the physicians will be getting affected by this insurance scheme, and definitely this will be beneficial for the patient rather than the hospital.
I have watched your interviews in TV shows and radios. Also read you in newspapers. Definitely, public would have given good feedbacks. How do you feel?
As you asked me, the health is wealth, this proverb. Similarly, I always follow this. It's very important to write some information regarding the health in editorials in the newspapers and channels, so that people can get some information regarding the illness and preventive measures, so that they can have a good health, so they can postpone the illness or they can prevent the illness.
How do you balance your hospital work with writing articles at Udayavani at Arogyavani newspapers?
When this is a habit, I think it is we will incorporate in our lifestyle, and I'll get definitely some time on I think the weekend. I'll write these articles, and probably I'll send for publication.
Does your family support you in your professional career?
As I told you in my previous interview, during my undergraduation and post-graduation, my total support is by my parents. They have totally supported me during my education time. Now during my practice and my in medical career now, this totally support my family, my wife and my children. They are supporting me, and I always this during my medical career in Kasturba Medical College. It is not only supported by my family. It is also my assistants and my postgraduate. They will be helping me during the patient care.
Sir, lastly, what message would you like to give to those who aspire to be a doctor?
I think medical profession is a very long learning journey, and after learning, it needs a medical experience to treat the patient. Experience makes you more perfect, and they'll begin the success in the medical profession. And when they do this medical profession, they should have a very important interest to serve the public, and they should not look at the money. Serving the public, and when people becoming sick and when they treat and they become all fine and they become all right, when they go home, we'll be the happiest person in the world. And we think that probably we have done serve the public, and we have done a great job to treat these people.
I'm very proud to say that you are my big part. I'll pray to God to give you enough strength to give good medical treatment to sick people. Thank you so much. Wishing you all the best.
Nidhi, all the best for your future career.
Okay, this is my interview with Dr. Susan. Hope you all found it helpful. Now, big thanks to Geetamani ma'am, my social teacher. Thank you for being my teacher and giving me this opportunity.